This essay example, as well as thousands of others, is available in text format on our website for free and without registration. Simply Google Ivy Panda Free Essays.
Human beings are social creatures that interact as they exist. Disorders such as anxiety, depression, mental problems, interpersonal disorders, and behavioral problems can only be dealt with via clinical psychology. Some models are used as the basis for the assessment of psychological problems. However, these techniques are not robust enough to provide good diagnostic results for various problems. This is because human beings are very different. The patient in question had panic issues. Heavy workload could have contributed more to her psychological issues. She had no time for consultation on her issues. Hence, she accumulated a lot of trauma that depicted depression. Another issue that manifested in Miller was anxiety disorder. She has been very aggressive from her mid-teen years. In addition, she manifested choking effects and was always in isolation, hence social anxiety disorder. Summary. History and background. The patient in question, Sylvia, started to demonstrate her psychological problem in the new town that they had moved to, which was New Jersey. Her problems were noticed at the workplace, the first evidence of her ordeal. Born in 1981, Miller was raised in a different town from the one she was living in. Her parents died when she was in her mid-teens, about 16 years of age. Left with two sisters, they moved to New Jersey, where they lived until she met her husband, Leon Kovitz, 10 years down the line. Miller's husband was a very busy man, while Miller herself had a lot of workload that resulted in a lack of time with her husband. She had demonstrated behavioral problems as a human resource manager. Medical and psychiatrist. Miller believes that her problems at the moment are related to work as she gets to meet a lot of people. In addition, she is incapacitated work-wise and has a lot of problems dealing with people. According to her sister's testimonials, her psychological issues have resulted from the family conflicts that she felt were her fault. She has isolation problems that could be related to after-divorce effects. The main effect noticed was meeting with new people or living in a totally new environment. Her workplace was new. The environment and the people, too, were new. This was challenging for her to adapt. With her social issues, she could not cope with her job position and responsibilities. Miller was a lovely girl since she was young until she turned 16. Her aggressiveness and isolation started manifesting at the age of 16. She reluctantly communicated with her peers and was always by herself. Miller was severely affected by the conflicts in her home, and she was not comfortable with conflicts involving her. She demonstrated the effects of fear and panic in case she was involved in a panic. This could consequently result in her isolation from people. Testing results. According to the Wide Range Achievement Assessment 4th edition, Miller was on subject evaluation tests to analyze her reading, math computation, and spelling abilities. She scored average in math and spelling on the basic skills test, but was excellent in reading skills. In the Children Color Trail assessment, Miller scored well, showing average results on interpersonal skills. She scored 100% in the first and 98% in the second. The house tree drawing results show that Miller's ego is very strong. Though she is aggressive and always anxious, she loves people and would love to engage in consultation work. However, anxiety and aggressiveness are rightly related to family issues. Finally, Miller does not have good interpersonal and communication skills. This is because her statements and explanations lack connectivity. It is tough to deal with people when there is a communication breakdown. Therefore, work positions and places were very stressful for Miller. The recommendations for Miller are indicated below. Miller's is a lovely lady, but she lacks confidence. She requires companionship whenever she addresses issues. The right person to stand with her is her husband. She would probably feel relaxed with him next to her. Miller has a problem communicating with people. She should find another job different from human resource management or one that has direct contact with people. It will be prudent if Miller goes for therapies that would help her work out the guilt and negativity she got from her family setting. Miller should create more time for herself, family, and friends. Her busy work schedule prevented her from resting and enjoying the delight of sharing with people. Miller should engage in programs to help her improve her communication and interpersonal skills. She can assess herself afterward by taking a slightly challenging job that would determine her progress. Visiting a counselor is good for any person who is showing psychological disorders. Therefore, Miller needs to take the issue seriously and visit a counselor whenever she feels depressed or disturbed. Miller should improve on her spelling and math problems by attending related classes. This would help her improve their basic skills and, hence, her confidence. It was a privilege to work with Sylvia Miller. Do not hesitate to recommend her to us whenever any further conditions arise. If you want to find more works like this report assessment on diagnostic impression, panic issues, head over to ivypanda.com. It has a collection of samples with thousands of submissions covering virtually all academic subjects.